Welcome. I'm Rogers Anderson, Williamson County's mayor, and today we have the distinct honor and really my pleasure to introduce to you a face that's been around the county for a long time, Don Webb, the Williamson Medical Center's executive director, the president, everything that possibly that you would want.
Chief Executive
Officer is the official title. Welcome.
Thank you. Appreciate it. I'm glad to be here today and welcome the opportunity to come and talk to you about the hospital.
Don, as most of the people that are going to be watching this show, they're very familiar with Williamson Medical Center. In fact, the studios is located in the old Williamson Medical Center building, and
I worked in this building when I first came to the hospital.
I did not realize it, but that's true.
That's true,
You
yes.
go back that far. Tell us a little bit about Don Webb. Where did life start for you?
Well, I was born in West Tennessee near Dyersburg, lived there until I was 18 and went away to college. And I think, interestingly enough, I didn't go to school in Tennessee like most people did. I went to school in Illinois, Southern Illinois University in Carbondale, and I went there primarily because it was far enough away from home, a state-supported school, that in those days you could establish residency and get your tuition at the state level, but it was also close enough to home that I wasn't that far away. And being a country boy, being too far away from home was an issue then. I went there and graduated with a degree in business and went on to graduate school. Studied accountant. I'm a certified public accountant and have worked in several types of business-related jobs, including healthcare consulting. Worked for the university for a while in the old days, worked for the medical school there. That's how I got into medicine. I came to Williamson Medical Center in 1985 in September as the financial person there. I won't the titles in those days were much different than they are today. The hospital was much different. The number of staff was much different. So, but I've been there since September 1985. Most of that time as Chief Financial Officer, as you know.
Don has done a remarkable job over the years. You have just been the face of Williamson Medical Center for me since I think I actually became involved with the hospital back in the late 80s, but I know you've been there a long, long time and done an outstanding job. Don, before we get to talking about some of the current issues that are going in, and of course healthcare is on everyone's mind this day and time.
Particularly this week.
Particularly this week, even though the show airs a little bit later, there's a lot on people's mind when it comes into healthcare. But let's talk about Williamson Medical Center today and the number of employees, board-certified physicians, and I think that'll lead us into some of the other discussions that the folks will really enjoy hearing today.
Okay. The hospital is licensed for 185 beds. It came into existence in 1957, 58. It's a district hospital in the state of Tennessee, which means it was formed through a petition to the state legislature to create a hospital district for the purpose of managing, operating a hospital. It's connected to the county in that way. Had a good relationship with the county for all of its existence, and particularly in the years that I've been there, the relationship's been really good. 185 beds. We have about 450 physicians that are on staff, with 140 of them what we would refer to as very active staff. We have about 1,400 employees, with 1,100 to 1,150 that are full-time employees. The rest are part-time or contract employees. Payroll for Williamson Medical Center is about $90 million for payroll, including benefits. We also buy supplies to the tune of about $30 to $35 million each year. Most of that comes out of Williamson County. We try to stay with the vendors in the county. We try to shop at home as we think that's the right thing to do. We see in the emergency room, for example, about 40,000 visits per year, encounters as we call them. That's about average for a hospital that's 185 beds. We're always trying to look ahead, and while we are a not-for-profit hospital, no one can really survive without generating a profit. The difference that we like to think of between us and a for-profit is any profits that are made at Williamson go back into the hospital, don't leave the hospital and go into other people's pockets. We put that money back into the hospital. We are not tax supported directly, but we do have, as I said earlier, a very good relationship with the county. The county has helped us when we've had need to borrow money and help support us with that. That has occurred while I've been there several times. Always, again, been very, very generous. The county has.
Over the last several years, and I ask you to kind of reminisce with me, we've had some good relationships, and we've had some relationships with other institutions that have been better. Currently, there's a lot of discussion about working with Vanderbilt and the many things that they could bring to the table here in Williamson County. Kind of give us an umbrella approach on that.
How that came about? The hospital board of trustees, along with administration at the hospital, 4 years or so ago, sat down and said, we need to start planning for the future. What is this going to look like to the best of our ability to determine what that's going to look like, and how do we position ourselves, Williamson Medical Center, to best fit in that new delivery model. And part of that charge was, can the hospital remain independent, or do I need to form alliances with other providers, whether that be other hospitals or other types of providers? So we engaged a consulting practice. We interviewed a lot of people from the community. We interviewed lots of the medical staff. Of course, we interviewed employees and talked with the administration and board members about what everyone saw as the future of healthcare and where Williamson fit into that and what would be the best opportunity for us if there was a partnership out there. What was it and who was it with? At the end of that process, which took most of a year, they came back, the consultants, through the board, through administration, and recommended that we do indeed form a partnership. No reason for us to consider a management of the hospital or a sale of the hospital, but we do need partnerships. We look to see who in our market, Middle Tennessee, we thought we could work with, who we thought had the most to offer Williamson Medical Center in Williamson County, and chose Vanderbilt to be that partner and signed an affiliation agreement with them in September of 2011. And since then, we've had lots of conversations, and we have some projects on the table that we could talk about if you'd like to. Well,
I think it is important as we discuss here at this show, there's probably people say, well, at what level, as our community continues to grow and offer and need to offer health care services to not only Williamson County, but many folks travel in from different counties to use the services of our physicians. And of course the hospital, as you and I both know, it's a place where bricks and mortars are at, and
right.
It's all referral from physicians. That's
right,
the way it works.
Right.
You really don't make a choice to go to Williamson Medical as an individual.
Someone sends you there.
And I think it's always been interesting to me that over the years we've looked at other institutions, and for various reasons the cultures didn't fit. We'll just use that word.
Yes.
You and I go back to one back in the 90s. It was kind of a brainchild that Ed just did not do anything at all, but out of that Harpeth group came some good alliances with some good locations.
And yes, and some physicians that came as part of that relationship that are still here now and practicing. The Grassland Clinic is the biggest group that came from that, and still here in the community, still practicing in the community. And we helped bring those physicians here, and 5 or 6 others that are around the community, most of which are still here. That was an experiment. It lasted about 4.5 years, and we then moved on and severed the relationship with the partners we had, and that was fine. It was a good learning experience, and the community got a lot of good doctors out of that, and they're, as I said, they're still here now. So.
And today, as we look in 2012 and then we look out into 2013, in order for Williamson Medical Center to offer the services that are rendered, but at the same time maintain the integrity of our bottom line, of the hospital's bottom line, we're going to have to look at some other things out there. Outpatient surgeries, which you know, we're going to pretty much stay within the confines of our piece of property that we're located in, but different clinics are going to have to be utilized, because it is so expensive for people to utilize the emergency room. Plus, it's very expensive for you to have to figure out, how do we deal with all of these? If we're doing 40,000, I think you said 40,000 a year.
Mm-hmm.
That's quite a few a day. I don't know what that math figures out to be right off the top of my head, but it's a large sum. And I'd say most of that's when Thursday, Friday, and Saturday.
Yes. that one of the problems with trying to staff the emergency room is what you've identified. The patients don't come in a steady stream. You have periods of time where you see 1 or 2 or 3 patients, and then the next 2 hours you see 7 or 8 patients, all of which have some major problem going on, and so it's very difficult to staff. What we would like to do, and one of the things that we used as a criteria when we were looking at who to form these relationships with and who would be a good partner, who already has things within the community that we thought would help us to position us to develop additional clinics, to move outside the 4 walls of the hospital, to get out into those communities where patients live, to bring health care to them rather than asking them to come to the hospital. Now, it's also when you have these clinics and outpatient centers, the cost is lower. The cost is lower to develop. The cost is lower for us to operate those, so that keeps the cost under control for us, and it's better for the patients. It's easier to get in and out. It's easier to park. All of those things work to the benefit of the patients, and it's in most cases less expensive to go to the outpatient centers. So there's been a real move at our place to develop clinics away from campus, to partner with Vanderbilt, in this case, our chosen affiliate, to partner in clinics that they already own and run within Williamson County. So we have those relationships underway. We're putting agreements together today for us to be partners in those existing clinics. We're working with Vanderbilt, and I'll tell you that we're looking at putting a clinic, a walk-in, in Brentwood. We're developing a clinic on Carruthers Road down from Williamson. We're developing a clinic in Thompson Station in that toll gate development. Vanderbilt has a clinic just further down towards the Spring Hill in Campbell Station. We're looking at partnering with them on that clinic. We're moving those kinds of services away from the main campus where it's more costly to operate and to build, and out into the communities where people live for convenience for them, and bringing higher quality, lower cost as many places as we can away from campus, yes.
And Don, when you look down the road, and if you're looking into that crystal ball, over the last several months, and particularly in the last year and a half, you've seen this great announcement that Vanderbilt has had, where they're having affiliations with not only Williamson Medical Center, but in Murray and as far away as Cookeville.
Yes.
And there's a reason for that, because this kind of leads us into the next discussion of the way that affordable health care is going to be delivered, how it's going to be paid for, and what the future patients can expect in terms of those services as we go down the road.
And what are we doing about that, and how do we see that changing? Yes. There's no doubt that the delivery models for healthcare are changing. The reimbursement models are changing. The payers, the insurance companies, the federal government, the state government, the individual patients are looking for, obviously, high quality care, but they want that at an affordable, a lower cost as possible. How do we do that? The other thing that the payers are demanding, again, the federal, state, the insurance companies, is they want for you to be accountable for outcomes and to be paid based on outcomes. If someone comes in and in the old days, under the old methods, the old thinking is someone gets sick, they go to their doctor, they go to the emergency room, or they ultimately become admitted to the hospital, they get made better, then they go home. And this new model, that's called an episode of care. The new model is we become responsible for a patient population, and we would provide every possible service that was available that we could provide to that group. And the goal there really is not to fix them when they're sick or hurt, it's to keep them well, keep them out of these service areas until they had no choice but to get into that. So becoming responsible for a patient population, a defined group of people, and providing all of those services, we said, how do we do that? Williamson does provide a wide range of service. We're a community hospital. We have to do that in order to meet the needs of the community we serve right now. But I don't provide all the services that you would need in order to manage a patient population. So I've got to go out and look again for affiliate partners, whether that be a Vanderbilt, or that be a large physician practice, or that be a home health agency, a nursing home. When you take on a patient population and you're responsible for health care, it's not just broken arms and legs and things that people typically think of as reasons to go to see the doctor and go to the hospital. We chose Vanderbilt. Vanderbilt has a reputation. They offer the highest level of services that are available in Middle Tennessee. They offer a wide range of services, and they have the children's hospital. They have the only real children's hospital freestanding in this area. So that looked like the good partner. That looked like the model that the country was going to, whether it becomes Obamacare or it becomes some other version of that. It's healthcare reform to us. It's moving towards managing a patient population. It's moving towards wellness as opposed to fixing things when they're broke. Vanderbilt was chosen as the partner because of what they could offer to us.
And two reasons. One is kind of let you catch your breath, but the other one is, and it'd probably be more apropos to ask Vanderbilt, why would you want to get out here in these different communities, going from Cookeville to Murray County and picking up along the way? Well, it's very simple. For them, they've got to get off their campus to offer some of those services in order to capture some of that population base, because their population certainly reaches a lot further than what ours does.
Yes. Let me go back a little bit. You mentioned that Williamson Medical Center draws patients from Williamson County primarily, but we also draw patients, maybe as high as 40% of our patients come from outside the county. If you're Vanderbilt, downtown Nashville, you're drawing a lot of patients, obviously from Davidson County, but you draw from all of those surrounding communities. The problem they have is that they're landlocked where they are. They can't grow any larger. It's too costly. The land is already saturated with buildings. And they really are an academic medical center. They look at and want cases that are good for teaching. They're associated with a medical school, a university, a nursing school. They look at cases that would help and benefit them. Cases that could be and should be done back in the community, that's where they want those to be. So forming these affiliations and partnerships with hospitals away from downtown Nashville makes sense to them and makes sense to us. Keep that care where it's most appropriately delivered, and the other end of that is that the costs are lower to do that care in the community hospitals.
Well, and you referred to it a minute ago, just in the next few weeks, there's a major certificate of need hearing that occurs in Nashville, that will occur in Nashville for Williamson Medical Center. If you don't mind, touch a little bit on what the certificate of need is, how that process works, just a small small conversation on that. But talk us through what is being anticipated for the Williamson Medical Center site just off of Highway 96 on Carruthers.
Okay, good. I really wanted to get this out on the table. In the state of Tennessee, we are a CON state, Certificate of Need. That means there is a state board that before you are allowed to build a hospital, build certain freestanding centers, you have to go to this state board and you prove three things. You prove that there is a need for it. You prove that that this fits into what they refer to as orderly development, that there aren't too many of these in a small area, and you also have to prove that this project is financially viable, that you can build it, pay for it, and it'll support itself. Those are the three things, and you go through a process with the state for approval. We filed an application with the state on the 1st of October, gave notice to the state, followed the process, filed our application to expand surgical services at Williamson Medical Center, adding operating room suites, and also to bring Monroe Carroll Jr. Children's Hospital to Williamson Medical Center in Williamson County. We're very pleased to be able to say to people who live in Williamson County that in the future you will be able to stay in the community. Your children are sick, your children need help. The pediatrician that you take your children to, that you go to, you can bring to Williamson Medical Center. We will have a children's hospital that mimics the hospital downtown, will be an extension of that hospital, and it will say Monroe Carroll Jr. Children's Hospital on the side. That hearing is the 23rd of January. There's a period of 60 days waiting for public comment before we go, and we will go, make our argument, present our case for need, orderly development, and financial viability on the 23rd. We anticipate that project being approved, and we anticipate construction beginning then in the spring or early summer of next year.
As important as that is, in that I have heard nothing in my travels but nothing but great news, and what a wonderful opportunity that our county and that our hospital, they are stepping up and offering those types of children's services. I happen to have, on a personal level, have some grandchildren here, and we've already made that trip to Children's Hospital a couple of times and falling out of a chair or a tree or something of that nature. So what a wonderful opportunity that the parents will have a choice. They can travel across town and go to the hospital and have those types of services and feel comfortable. And if they need additional attention, then they can take the journey on into Nashville.
That's right. And there will be agreements where we would then make that judgment, transfer that patient on downtown. What's proposed at Williamson for the Children's Annex is a 3-story addition on the west side of the building. The ground floor of that addition would be a children's ER that's next door to the hospital's current ER, but separated. You want it to be separate. This is for children. You want that experience for those children to not be scary. You don't want them coming in with the other folks. They have their own entrance, their own ER, their own decor, and they'll have their own staff. It's a children's ER with pediatricians and ER doctors that are trained to work with children. Above that would be a 16-bed children's hospital, for lack of a better word. 16 beds, 4 of which would be for observation for patients who may or may not need to be admitted. But if you need to be admitted, if you need surgical services, we can put you in Williamson Medical Center in our annex, children's annex, have the surgery done there, and you don't have to leave the community. Go downtown. Your relatives, your friends, your family can stay here and visit and be with that child when they're having service. And we think we're very happy about the Children's Hospital.
Well, I think the Board of Trustees has studied this under the direction not only of yourself and and the senior staff out there talking to Vanderbilt is very much needed, and we do say thank you to Vanderbilt because this is the first time they've gone off their campus with something like this.
Exactly. It's not only the first time they've moved those services away from downtown, but it's the first time that they'll have their name and allow that name to be used on a building away from the campus downtown. And you know, as you and I have worked on this project for 5 or 6 years, how difficult those conversations were, and to get people to agree to allow that to happen. And we were so pleased when we were chosen to be the site for the Children's Hospital. It will be the same quality as the hospital downtown, the physicians same quality as those downtown. It will be Vanderbilt Children's Hospital, but located in Williamson County.
Don, we've got about 2.5 minutes left, 2 minutes left, and as important as of the upcoming CON hearing for Children's Hospital, you did allude to expanding our operating surgery, and that in this day and time is almost hard to understand, but then when you look at all the growth we're having in Williamson County, we just need more rooms to do surgery in.
Yes, we do. It's mentioned a minute ago about the ER. It's not a steady stream. In the surgery, it's not a steady stream either. But you do have days when you can't get booked if you need surgery. This is the end of the year. We have elective surgeries. People who may have put something off, well, they want to get that done before the end of the year. It's very difficult right now to get that scheduled at Williamson Medical Center. But what we're talking about with this is taking the hospital's OR, the operating rooms, renovating those rooms. What we're doing is taking those rooms, in some cases making them larger, re-equipping them, because we want to do and need to do more joint cases. Williamson Medical Center does more joint cases than nearly any other hospital in Middle Tennessee, and we expect that to grow. We have physicians out here, orthopedic surgeons that are world-renowned, as you know. We have a medical staff that is second to none. That's going to grow. We need to be positioned for when that happens to the best of our ability to meet that demand and meet the needs of the patients out here. We're very happy about that expansion program. We have outpatient surgery at Williamson. We have inpatient surgery. These programs are growing, and we're very pleased about that.
Don, we could have another show. We may need to invite you. We're out of time. Thanks for being with us today.
Well, appreciate you inviting me.
And thank you for your leadership as the CEO of Williamson Medical Center. I'm Rogers Anderson. We'll see you around the county on down the road.